Welcome, everybody. Welcome. It's so great to have all of you tune us in and turn us on. And one of the things that I want to say to everybody is that you've heard us talk about chronic pain now for over 10 years. Why? Because you've heard me here share my story, and you've heard us talk with Lou Paradise, who has been an advocate. But what have been the advancements? Well, you also heard me talk about I wasn't very optimistic until now. Today, joining me here today is Dr. Corey Hunter and Doug Rott. And why? Why are we here? You're going to hear about Doug's story, and you're going to hear about the innovation that we're bringing to you. Innovation that most people thought would never happen at all. But chronic pain in September, Pain Awareness Month, it's not the awareness about the pain that we're going to focus on today. It's the awareness about the possibilities to relieve the pain. Dr. Hunter, Doug, welcome to the show.
Thank you.
Hello. Let's talk a little bit about the epidemic that everybody hears about, which is opioid epidemic. The thing that also we should mention and just briefly mention is that anti-anxiety has also now exceeded the amount of opioid prescriptions and is directly related to chronic pain. So one of the things I want to ask each of you is, what have you learned about chronic pain? And what are you finding now is so difficult in treating it? And let's start out with you first, Dr. Hunter.
So broadly speaking, chronic pain is any kind of pain that lasts longer than 6 to 8 months. What makes it so difficult to treat is that once the pain stuck around for that long, it may not be coming from the same spot anymore as where it started. So what may have started out as something as simple as a sprained ankle or a broken arm, after 6 to 8 months, the pain may not be coming from the ankle or the arm anymore. It may have moved. And because we don't really have any way to pinpoint where the pain is coming from, we don't really know where to focus the treatment, and that's why it becomes so hard to treat over time.
And, you know, we're talking about something, and I want everybody to be familiar with complex regional pain syndrome, right? Really want to be familiar with this. I never thought in my day and age that I would hear so many people suffering with pain. How about you, doctor? I mean, let's talk about this for a minute. It's not just like it's a sidebar conversation or a water cooler conversation. We see people not able to walk down the hall at work. We see people rubbing their hands. I mean, this is not just like a drive-by conversation about pain, is it?
So, yeah, chronic pain can take many forms. It can be chronic headaches. It can be chronic knee pain. Complex regional pain syndrome, which we abbreviate CRPS, is really like the ultimate one that we see in pain management. It's something that not a lot of people are familiar with or have heard of until they themselves actually, are unfortunate enough to have it, or they know someone that's afflicted with it. Patients who have it call it the suicide disease because this is something that they would rather not go on living another day than have to deal with the pain at this level. We don't know a lot about it insofar as like why some people get it and some people don't, but it starts off with something just as simple as an injury or a routine surgery, and then the body's healed, but the pain just kind of continues over time and gets progressively worse to the point where now it spreads, and then wherever that injury or surgery was, you can't even use that limb anymore.
Oh, I know. And let's get right to that with somebody, right, that knows a lot about this. Doug Rott is joining me here today. And what I want to say is medically retired U.S. Army paratrooper, damaged both his knees after years of active duty. And as a result of these surgeries, let him talk about it. Doug, it's great to have you here. Thank you for coming out and talking about this. Yeah. Wow. Did you ever think this would be you?
When you're young, you think you're pretty indestructible.
Yeah.
With every passing year, I find that I am not. But in terms of where I've been and where I am now, it is a night and day difference. I can't begin to describe how it is to go through this process and then to kind of end up on the other side.
Yeah. And let's talk about the process. If we could, Dr. Hunter, we're here to talk about a solution. So let's talk about, the neurostimulation therapy. Let's talk about that solution. And I want to make sure folks hear that term over and over and over again. First, for you, Dr. Hunter, what is it? And then for you, Doug, we're going to get back to you because I want to hear what the journey was like the minute that you were treated with this. Go ahead, Dr. Hunter.
So the Abbott's DRG stimulator, and really in a nutshell, is the easiest way to describe it is people are very familiar with a cardiac pacemaker, where we're using electrical signals to help the heart beat correctly. In a similar way, we're using these electrical signals in the nervous system to alter pain signals instead. And it's electrical signals that patients can't feel. And this particular therapy is the first of its kind because for the first time we have, proven an effective therapy to treat complex regional pain syndrome and focal chronic pain. And for the first time, I'm able to look my patients in the eye and tell them there's a really good chance I'm going to be able to give you your life back, and you may not need medication to do that. So it's really for us, as physicians, it's remarkable to be able to have that level of comfort and confidence knowing that we can actually deliver on the promises that we're making.
Oh, I got to ask Doug this question. Doug, here you go. When you heard this, right, like, oh, we're going to be able to help you, did you actually believe that at first?
That's a great question. You are so desperate. When you live with chronic pain, you are so desperate, and yet having had so many surgeries, and I think they exceed 20, you're somewhat skeptical. But the idea that there's even a glimmer of hope that maybe you can get your life back, as Dr. Hunter had stated, you're willing to try anything. And the nice thing about this process is you're allowed to give it a try. You have a trial, and if the trial works for you, then you can move forward and get the implant.
Wow. Let's talk about this because, before I came on air here, Dr. Hunter, I did a little work, but I want to make sure people know the website. For those of you tuning in, go to the website aboutyourpain.com. And when you get to that website, what you're going to be able to do is you're going to be able to, well, wait a minute. Is there anybody close to me that I can get some relief from? We're going to talk about that as well. And by the way, I've already done this, and I've already looked it up. And by the way, Swedish does this here where we are. But let's talk about this. How does the process work, Dr. Hunter?
So if you go to the website aboutyourpain.com, you can learn more about the DRG therapy, learn about the conditions that are being treated with it, and find a physician in your community who's trained to use this. There's a physician finder. You can plug in your zip code, and it'll show you a list of physicians in your area. If you're interested in learning more about it or seeing if you're a candidate for it, make an appointment with a board-certified pain management physician that's trained in DRG therapy and discuss your condition and see if it's the right treatment for you.
Right. Can we talk a little bit, Doug, if I jump back to you? You were treated with very specific injuries, right? And when was the first time you got relief? I want to know, what happened when all of a sudden you're like, oh, I don't feel the pain here.
It's almost unbelievable. It is, and the idea when you go through the trial that there is something that could possibly rid you of this everyday throbbing and swelling and needing a cane on occasion. It's almost like a fantasy. It's amazing.
Yeah.
And I had the surgery the day after Thanksgiving. The Abbott DRG stimulator was implanted then. Mm-hmm. And I am so happy to tell you that after 10 years of opioid therapy, spinal column stimulator use, I have not had pain medication since the second week of February.
Wow.
Yeah, it's amazing, isn't it?
It is amazing because I, too, was looking at a wheelchair in 2008. So,
gosh.
You're talking to somebody that's is really up close and personal. I get it. And that's why I was so excited to do this interview, because when you're at the other end of a doctor's conversation, not you, Dr. Hunter, not you, but when you're on the other end of a doctor conversation and the best that they can offer you is a prescription, it is really difficult to have hope, isn't it, Doug? That is really hard to do.
It's disheartening. I can't tell you how many times my wife and I have wept.
Yeah. I want to get back to you, Dr. Hunter. I want to know what your vision is to get this in doctor's offices, naturopathic offices, chiropractic offices. I could go on and on and on. But how do we get this in the places where then those people can relieve other people of pain? How the heck do we do this?
Well, I mean, it starts with, what we're doing right now, is just getting awareness out about this therapy. We've, as I said, I really can't understate the fact that we haven't seen anything like this before in pain management, something that's so reliable, something so consistent, something that's so unbelievable for these patients. Doctors are more and more finding out from other physicians, and I think they're even finding out more from patients, because patients are sharing their story, like Doug's story, and patients they're really, I think, just the best candidates to tell people about how effective this is. So it really just starts with getting awareness out there for it. And I think as more doctors are comfortable in seeing that this is real, if they themselves aren't doing it, they should be finding other doctors in their area to refer them to. So this is something that we need to get off our reliance for opioids, because there really is no exit strategy from once you started. It's going to go on forever. It's putting a Band-Aid on a bullet wound.
Yeah.
This is really kind of we're addressing the injury, we're addressing what's going on, and we can get patients. This is going to be our first step. This digging us out of this opioid epidemic is having this very treatment right here.
Yeah, and so I want to just I'm a researcher at heart. I got to give people a number. Listen, a long-term clinical study showed that DRG stimulation provides pain relief to more than 8 out of 10 people. That is an 80% ratio. Knock off the margin for statistical error. Have you ever seen anything like that?
In pain management, no. So in the clinical trial, it showed that it was about 94.6% effective, which is that's at the range of penicillin. So we don't have anything that's this effective and especially this reliable.
All right, I got one last question. I know you got to run. Each of you, I want to know what your personal message is. I'd love to know what you want to leave people with, and let's give them some information. Dr. Herner, why don't you go first, and then Doug, you can go.
So again, just really go to the website aboutyourpain.com. Read more about this amazing life-changing therapy. Find a doctor that's there. But if you're on opioids, or if you're considering taking opioids, look into this therapy first before you do that. It really could save your life.
Thank you, Doug. How about you?
I cannot overemphasize the change of 10 years of having to deal with chronic pain, and then like a light switch, getting my life back. And I've said before to the others here that I'm renovating a house. My wife and I walked 3 miles last night, and I'm riding a motorcycle again.
Oh, my gosh. I love that.
Yeah, I've kind of got my life back. It's wonderful.
Yeah, okay. I'm sorry. I told a little tip. What kind of motorcycle did you get?
Well, I have two. I have an old 1970 Triumph 650 and a 76 BMW.
I come from a motorcycle family. My first bike was a Triumph. My second bike was a BSA. And guess what?
Nice.
Us motorcycle people, we don't like the pain, do we?
No, not at all.
All right. Thank you both. Thank you so much for joining us. Everybody out there, aboutyourpain.com. Much more you're going to hear about this. All right, everybody, we're going to take a short break. We'll be right back.